turn over the questioning to Senator Conrad, again, publicly thank him for entrusting me with this responsibility 2 years ago to look at this subject area. No one in the Senate has been a clearer voice for government efficiency, the concerns around the deficit and the debt than Kent Conrad, and I appreciate him giving us this chance and look forward to his questions.
Well, thank you, Senator Warner, and I want to thank you for the leadership that you've demonstrated and that this subcommittee has demonstrated in exploring this whole notion of how do we get the government to perform better. I think Senator Johnson asked some worthwhile questions. They're the kind of questions I get when I go home and talk to people. You know, government is deeply challenged when it comes to doing things in the most efficient way, because the reality is there are competing visions of what needs to be produced. And those competing visions create conflicts, and where there is conflict, there is additional complexity. And one of the jobs we have, and I think increasingly it's going to fall to the Budget Committee, is to help agencies separate the wheat from the chaff and to cut through the haze that's out there and determine what is the mission and how is it going to be accomplished, and by what metrics are we going to measure whether or not the performance is what we expect. You know, I used to be the tax commissioner of my state, elected tax commissioner, and one year I convinced the legislature to give me an additional $1 million to audit companies that were doing business in the state of North Dakota. $1 million doesn't sound like much money in this town, but in North Dakota in our legislature was a lot of money. And the commitment I made that I believed I could raise $10 million with that $1 million. And I tell you, they held me to account. Every quarter I was called in for 2 years and had to go through a detailed report of what I was doing with the money and what results I was getting. That rarely happens around here. One of the reasons it rarely happens is the press of the business of the year that you're in. And it's one reason I've been persuaded to now support a biennial budgeting process so that we do budgets for 2 years. That's all we're doing anyway. I mean, the only time we've had a budget in an election year was the last time I was able to get one in 2008. Other than that, we don't do them in an election year. So let's recognize the reality. Do 2-year budgets in the off year, spend the other year holding agencies to account. What is it that you were given the money? And I like very much the idea of tying budgets to performance. What is it that we expect you to accomplish? What are the goals, and what are the metrics that we're going to apply to determine whether you're getting results? Now, you know, there are places where that's very difficult to do. Probably nowhere more difficult than the Department of Defense. But I can tell you, after serving on the President's Fiscal Commission and having the testimony that 51% of all federal employees are at the Department of Defense, and that doesn't count the contractors, and when I asked them, how many contractors have you got, they said, we can't tell you. And I thought, you know, maybe it's a security matter. No, we just can't tell you. We don't know. They said, well, give me a range. They told me 1 to 9 million. This is the testimony of the best defense analysts, that we've got 1 to 9 million contractors at the Department of Defense, and they can't tell you whether it's closer to 1 million or closer to 9 million. I mean, Mr. Johnson, you're in the business world. I'll bet you didn't run your business and not know how many contractors you had or what contracts you had outstanding or for what amounts or what the purposes of those contracts were. And I don't want to single out Department of Defense because we've got lots of other management areas. I go to the Department of Education, and I am a very strong supporter of education, but the duplication there is really daunting. And, you know, is it possible that some of this duplication is merited? Well, perhaps it is. But, you know, I'll bet a lot of money some of this duplication is absolutely wasted. One of the questions I've always wanted time to explore is, we put money into a program to deliver certain results out the other end. We spend very little time connecting the dots. we put the money in. What comes out the other end? How much of it actually gets out to the places where it is intended? How much gets absorbed in the bureaucracy on the way? One reason that I got very interested in this was during the flood disasters in North Dakota, we looked at what other states had done, and what we found was states like to have the money sent to them, and then they distribute it to the impacted area. And one reason they like to do it is they take what they call a haircut. And the haircut can be 15 or 18, as much as 15 or 18%. Well, wait a minute. What sense does that make? When we had our big disasters, we insisted the money go right to the communities of need and not go through the state for their haircut. And I think we saved a lot of federal taxpayer dollars by doing it. Let me just go quickly to my question. And that is, what do you see as the biggest targets of opportunity? Both of you are deeply experienced in the federal government. Mr. Podesta, in your experience, what are the key targets of opportunity for improvement in performance?
Well, Senator, I think that you've highlighted a couple of them. One is duplication and elimination of duplication, to try to put dollars to more effective uses and increase the return that you get on the investment. I would say, and I'll come back to it, I think that in the arena of healthcare, there's tremendous savings that still can be done by changing delivery models, changing pricing systems, paying for performance, if you will, and producing better results at the end of the day by stopping hospital readmissions, looking at the kinds of things that I think are embedded in the new authorities that exist in HHS. And again, Medicare, Medicaid, that's where the money is now in the federal budget. That's where we're going up. So if we can't get higher levels of performance for the dollars being spent there, the rest of what we're talking about is kind of swamped. But I think there's probably no agency that can't be held to that discipline. If I could, I'd just put in one pitch for transparency. I think to the extent that the model just simply isn't the Congress overseeing the federal government and its results that it's producing for dollars, but the American public having the capacity to oversee some of those results, we're going to be better off. And I think the experiments with recovery.gov, with data.gov, putting information out, I mentioned the website we put up in terms of return on investment for public education dollars spent, both at the federal and state level, so that you can go to two similar school districts in Wisconsin, one spending $50 million more than the other and producing the same results, and begin to ask the question, well, why is that? And I think empowering citizens with the tools to be their own, if you will, GAO and inspectors general to demand higher performance will do what you saw in North Dakota, Senator, which is that people will come in demanding quarterly results or maybe annual results and higher levels and higher performance out of all levels of government.
Senator, I agree with what John said. The areas, I'm not optimistic that you'll be able to reduce, to combine or reorganize the government to consolidate a lot of these duplicative areas. But what you find is that often, though they have the same purpose, they're working against each other. Food safety is a perfect example where you have two agencies in the same plant, and when an incident occurs, the agency that takes over depends on the product causing the incident. They shut out the other agency so they don't get the benefit of what that other agency is learning to enhance food safety. So the best opportunity, it would seem to me, is to ensure that though this duplication exists, these programs are collaborating better to achieve a common outcome. And I'm not aware that's happening to a great degree in any of the areas inventoried by GAO.
And I just say my vote for the biggest target of opportunity would be Medicare. 10% of beneficiaries use 50% of the money. Half of the budget, 10% of the beneficiaries. And I've always been persuaded that we ought to focus like that, focus on that like a laser, because what we'd find, I think, is tremendous duplication of testing, tremendous overutilization of prescription drugs, causing adverse drug interaction, as a result causing hospitalization. It's one of the biggest causes of hospitalization is adverse drug interaction. I think there is huge savings to be garnered there, and as we go forward, I want to put a laser-like focus on that statistic.
Senator, you raised the Defense Department also, and we've spent a lot of time and attention on the procurement side and the system side of things that don't work and ways to produce value for lower costs. But healthcare at DOD, as Secretary Gates testified yesterday, is an increasing problem. It's now over 10% of the base budget. It's in real. I know it's politically sensitive, but it's in real need of reform, and we've thrown some ideas out on how TRICARE can be reformed as well.
I'm probably treading in an area you know a lot more about than I do, but as you know, the government makes more than $125 billion annually in improper payments. So each agency is working diligently to solve that problem. They all have different methods for verifying the eligibility of their recipients, and they all often establish their own sources of data to verify that eligibility. We could do a better job of creating a single, or at least a set of common data elements that agencies can use to verify eligibility, and then give them access to sources of data that they all have, they should all have access to.